Good morning, everyone, and welcome back to our channel today. So excited to be here, sharing with us today another topic, um, which has actually been a burden in my mind. Endometriosis. It's what we'll be describing today, because of the kind of pain people who have it undergo and the difficulty in getting access to treatments that they undergo. We will be describing what endometriosis is, the risk factors, the causes, where it takes place in the body, and how we can get treatment for it. So you're welcome, and please don't forget to subscribe to this YouTube channel for more videos, and also to look up our previous videos. Thank you so much. You're welcome again. So what is endometriosis? You know, we say endometriosis is a condition that happens when a tissue or tissues that are similar to the endometrium grows outside the uterus. Okay, and the endometrium is the lining, the uterine lining, the inner lining of the uterus. The uterus, that's the womb. Okay, so that tissue is where implantation takes place. And so if a similar tissue to that of the endometrium is growing outside the uterus, that means what can happen in the uterus can also happen outside the uterus. So that's just a simple explanation of what endometriosis is, because that tissue will just act normally like a normal, regular uterine tissue. Okay, so during the period, you expect it to build up, even though it is outside the uterus. You expect the tissue to build up, and then once implantation does not take place, once there's no fertilized egg and there's nothing to be implanted, then the tissue breaks up apart and then cause bleeding, which is normal menstruation when it happens in the uterus. But this time, this blood has nowhere to go. The surrounding areas become swollen, and then you may have scar tissues and lesions. And at times, the blood gets to flow into the pelvic area, provided that the endometrium is still growing around the uterus and grow outside there. Okay, and very commonly, you have endometrial tissues in the ovaries. So, the normal endometrium, just like I said, is the inner lining of the uterus, okay? Just like it's been highlighted here, that's the endometrium. And this is a normal one. But when endometrial tissue, the tissues lining here, for some reasons which you will see in the course of the video, begin to grow outside the ovary, okay, on places outside the ovary, then such tissues will still act not like just the endometrium, and it leads to what is referred to as endometriosis. So what are the types of endometriosis? Three main types, basically. We have the superficial peritoneal lesion, and that's the most common kind of endometriosis. The lesions are on the peritoneum. The peritoneum is a thin film that lines the pelvic cavity. Okay, the pelvic area, the pelvic cavity are the areas around your hip bone. So when you have lesions on the peritoneum, you have what is referred to as superficial peritoneal lesion. Okay, and then we have the endometrioma. That one is one that happens on the ovary. Okay, it consists of dark fluid-filled cysts, and those cysts are also called chocolate cysts from deep in the ovaries. Okay, and one thing about them is that they don't respond well to treatment, and they can damage healthy tissue. Then we have the deeply infiltrating endometriosis, and this type grows under the peritoneum, okay, and can involve organs near the uterus, such as the bowels or the bladder, okay? And then about 1 to 5% of women with endometriosis have the deeply infiltrating part, okay? And then about another 10% of endometriosis occur outside the pelvic cavity, in places such as the intestine, the genitourinary system, that's anything around the genitals and the bladder, the kidney, the lungs, the skin, and then there are few reports of endometriosis in the stomach. Okay, so there are these are organs that can be affected by endometriosis, and in fact, beyond even those days, the liver, the kidney, the reproductive organ, the intestines, the brain. Besides these, it has been found on, I have personally encountered someone with bleeding on the nails, during the time of menstruation, the person sees bleeding on the nails. That's scary, interesting, but then it can occur even on the fingernail. So the only organ that endometriosis has not been found on is the spleen. Okay, so it has been found on all body organs. Think of it, even imagine endometriosis in the brain. All that has to happen is that the endometrial tissue is found in that organ, and then it begins to act just like an endometrium will act. All right, so what are the symptoms of endometriosis? Okay, the most common of them is painful periods, dysmenorrhea. In our last video, we did discuss dysmenorrhea in details. You can please look up the last video, and please do not forget to subscribe to this channel, like our videos, and share with others. All right, so when we have pelvic pain, cramping, that usually begins before the period and extends even beyond, the period, and lower back and abdominal pain. This is painful, okay? This kind of pain is not just the normal cramping that women have during periods. It's pain that is deep, okay, that interferes with daily activities where such menstruator cannot do the normal activities of the day. Okay, then another symptom is pain with intercourse. When you have painful sex during or after, is common, is one of the symptoms of endometriosis. Then pain with bowel movements or urination, okay, especially during the menstrual period. Excessive bleeding, very heavy menstrual period, or bleeding in between periods. When we say heavy, that is when you have to change whatever menstrual product you are using in less than 2 hours. You're using a pad, a tampon, you have to change it in less than 2 hours. That's heavy. That kind of period is heavy. Then another symptom is infertility. Okay, usually endometriosis is even diagnosed first in those seeking treatment for infertility, because we have a way of containing pain so much that we tend to normalize it. It's just normal, and then people don't go to seek treatment when they have dysmenorrhea. Okay, so most times the first point of diagnosis is at the point when such people are trying to reproduce, and they find out that they are not able to. Then other signs and symptoms include fatigue, diarrhea, constipation, blood in the stool or urine, bloating or nausea, especially during the menstrual periods. Okay, so let's look at the causes. What are the things? What causes endometriosis? Well, interestingly, the exact cause is not known, and this is also the treatment is even also dicey. Okay, well, there are certain common associated causes, which includes retrograde menstruation. Normally menstrual blood flows from the uterus. When the endometrium breaks apart, the menstrual blood will flow from the uterus through the cervix into the vagina, okay, and out into whatever product you are using to collect it. But in the case of retrograde menstruation, the blood flows back into the fallopian tubes and the pelvic cavity. And when this happens, some of the tissue of the endometrium gets to those other organs into the fallopian tube and the pelvic cavity, and then the tissue begins to act like what it is, the endometrium. All right. Another cause may be hormonal imbalance in the body. Okay, then when we have surgical scars from cesarean sections or hysterectomy, that's the removal of the uterus. So such can also lead to endometriosis. Okay, then when we have endometrial cell transport, okay, when the blood vessels transport endometrial cells to other parts of the body, just like in the case of the retrograde menstruation, when the endometrial cells is being transported to other parts and they begin to grow there. Then we have immune system disorders can also lead to endometriosis, as well as genetics. That means it can be inherited, can be passed down from parents. So what are the risk factors for endometriosis? We have age, usually endometriosis is not covered early, because at that time, at menarche, usually or normally, menstruators are not trying to reproduce. And like I told you earlier, that it is infertility that usually drives people to go and seek treatment, and then they find out that they have endometriosis. So between the age of 25 to 40, is a higher risk factor. Then family history. When endometriosis runs in the family, when you have more than one relative who has it, a mother, an aunt, a sister with endometriosis, or having a family history of uterine cancer or colorectal cancer is also part of the risk factors. And also never giving birth to children. Okay, when you decide not to have children of your own is one of the risk factors. When menarche starts at an early age, it's 12 years, especially nowadays, we have girls with earlier onset of menarche, earlier than the average of between the age of 12 to 13. So we have people as early as age 8, 9, who are starting menstruation. That is one of the risk factors for endometriosis. Then going through menopause at an older age. That means that you menstruate for a longer time. Menopause does not come early, like it goes beyond age 55 before menopause. That is a risk factor. Short menstrual cycles of lesser than 21 days is also a risk factor, while heavy menstrual periods that last longer than 7 days is a risk factor as well. Then when you have higher levels of estrogen in the body, I talked about hormonal imbalance as one of the causes. When you are having higher levels of estrogen in your body, or a greater lifetime exposure to estrogen your body produces. Okay, then we have low body mass index. And in low body mass index, our BMI, we can calculate it by dividing your weight in kilogram by a square of your height. What do I mean? The weight, get the weight in kilogram and get your height, get the square of your height, because you have to do your height in meters squared. So get your height in meters and find the square of it, then use that value to divide the weight. That's how to find your body mass index. So low body mass index is one of the risk factors. And then any medical condition that prevents the passage of blood from the body during menstrual period, anything that does not allow menstrual blood to flow out of the body. Then lastly, disorders of the reproductive tract is also another risk factor. Okay, so we are moving on to diagnosis now. How is it found out? How do doctors diagnose endometriosis? Two methods, mainly physical examination and tests. So for the physical examination, usually carry out the pelvic examination. The physical examination of the pelvis, what are they looking for? Abnormalities such as cysts or scars behind the uterus. So that's for the physical examination. And then the tests includes ultrasounds to detect cysts associated with endometriosis, and then laparoscopy to identify the location, the extent, and the size of the endometriosis. And if found, laparoscopy can also be used to remove the cyst. Same procedure. Okay. Then other treatments, conditions include medications and then surgery. Okay, the medication are mainly to relieve the pain. Don't forget I talked about dysmenorrhea. There's a painful cramps. Some people have described this like the intestines trying to pull off. Okay, excruciating pain. So you have to use analgesic or other NSAIDs to reduce the menstrual cramp. And then there is therapy, the hormone therapy, where to eliminate the pain of the endometriosis. Don't forget that hormonal imbalance is one of the main causes of endometriosis. And then surgery, the laparoscopy to detect and remove the endometrial tissue wherever it might be found. And then another surgery that could be performed is hysterectomy, and that's the removal of the uterus, the fallopian tubes, the ovaries, just to ensure that the endometrial tissue don't go elsewhere. Okay, so yes, interestingly, or let me say interestingly, it has been found out that even after treatments, including surgery, there's a lot of complication that people that have undergone such treatments have encountered. Okay, and such complications may include fertility problems, that is the inability to give birth, fertility problems, long-term pelvic pains that interferes with social and work activities. Okay, some people cannot even keep friends. It's that bad. They can't keep friends because, imagine you have a friend, you have a call, we'll be going to, let's say we'll be eating the gym tomorrow, or let's say we'll be going to the supermarket tomorrow, there's something I need to do, I need your help, and then you have agreed and this thing comes on and the friend is like, yes, this is the day we agreed to go, and you're like, I can't do this. Such friend may find you weird, and if the person is not able to understand that this is endometriosis at work. Then when there are large cysts in the pelvis, they may break open, they may rupture, okay? And this leads to even more complications. And in rare cases, the endometriosis, the tissue may block the intestines or the urinary tract. And when it does that, that means the normal metabolic activities that goes on in the intestine and in the urinary tract cannot take place. And of course, that would lead to further complications in those organs. Then, very rarely though, it may result into cancer. Okay, those area of tissue growth outside the uterus can result in cancer after menopause. Okay, so is there anything we can do to prevent or slow down development of endometriosis? Thankfully, there are a few things that can be done, especially if you know you have one or more of the risk factors. Okay, so you should be looking at this prevention method. You should exercise regularly. Okay, exercise regularly. Let it be intentional and regular. So reduce the intake of junk foods. Eat healthy. I'll still tell us foods that we can easily eat that are healthy for people with endometriosis. And you should please reduce the amount of alcohol or caffeine, especially when you know you have one or more of the risk factors. Okay, so when do you see a doctor? If you have the signs and symptoms that may indicate endometriosis, please see a doctor because it can actually be a challenging condition to manage. It affects everything, social life, emotional life, you know, it affects everything. It affects even work, okay? And early diagnosis, a multidisciplinary medical team, and an understanding of your diagnosis may help you to better manage your symptoms, okay? And then usually the endometriosis doesn't show early, okay? So it may improve. Some of the signs and symptoms may improve with pregnancy if you're able to get pregnant, and may completely go away after menopause unless you're taking estrogen. Don't forget that high increase in the level of estrogen is one of the risk factors. So what are the questions to ask your doctor in case you are undergoing treatment or you find out that you have the symptoms of endometriosis? You can ask about what will the recovery time be? How long will it take to recover? Will there be a recovery? Will it take long? Okay, and then you can ask the doctor if you are going through surgery, will I be completely cured? Because honestly, even after surgery, some people still get to go for more surgery or other treatments. Okay, so you want to know, will you be completely cured after surgery? Then you want to look for the symptoms. What are the symptoms to look for in case of any other complications? What are the things that are normal or the things that are not? Okay, then when should I come for a follow-up check? So those are questions to ask the doctor. Okay, so like I promised, what are the kinds of food to eat? Okay, please don't forget to subscribe to this channel, share with others, like, and please drop any comment. If you have a question, you can also drop your question at the link below. Okay, so a high fiber diet is very important. Okay, that's including a lot of fruits, vegetables, beans, and whole grains. Okay, whole grains, your brown rice, okay, the oats, the beans, lots of vegetables, high fiber diets that can help to move the bowels easily. Then you should limit saturated fat-based foods. Put a limit to it. We should do that by choosing low-fat dairy products. Okay, low fat, such as Greek yogurt, cottage cheese, hard cheese, string cheese, chocolate milk, fortified yogurt, fortified milk, organic dairy. Okay, those ones are low-fat dairy products. And we can also limit the choice of saturated fat-based foods by choosing lean meats like turkey breast, the skinless type, chicken breast, the skinless and the boneless type, beef liver, and pork. Those are just some examples. Then you can eat more sources of omega-3 fats, such as fish. The fish you can eat includes salmon, mackerel, herring, sardines. Okay, they contain omega-3 fats. You can take fish oil, canola oil, flax seeds. And then we should also eat a lot of magnesium-rich foods to soothe the uterus and reduce pain. And this includes pumpkin seeds, sunflower seeds, black beans, avocado, almonds, banana, and spinach. So these ones will help us to soothe the uterus and reduce the pain. Okay, so a quick fact I'll give you that is that endometriosis is associated with ectopic pregnancy. They have common underlying risk factors. What do I mean? If the endometrium can grow outside the uterus, wherever it grows, and it's able to act just like an endometrium. And you know, the endometrium is the tissue in the uterus where implantation takes place. That is the baby, blastocyst, the egg, the fertilized egg. get implanted and begin to grow into a baby. So if you look at this picture, this is a normal pregnancy where the baby is growing in the uterus, okay? But here, because endometrial tissue is found there, okay, the baby is able to grow outside the uterus, in this case, in the fallopian tube. So they are associated, endometriosis and ectopic pregnancy are associated. Thank you very much for watching today. I really appreciate your time, and I'm sure to tell you that you will have more public health videos from this channel. Thank you, and please don't forget to subscribe. Thanks again.